Hi, my name is Catherine. I'll be your nursing student for today. Can you tell me your name and date of birth? Sue Quinn, date of birth is 7/21/1951. Do you have any allergies? You do? You have levofloxacin and also strawberries. Okay. Well, I'm going to go ahead and wash my hands real fast before we get started. So today I'm going to be doing a wound dressing change on you. Have you had that done before? Yes? You had it done yesterday? Okay. Well, I'm going to go ahead and take a look. Oh, I'm so sorry. A look at your site real fast. Okay. All right. And I see it was changed at 10/7/22 at 10 yesterday. Okay. So I'm going to go ahead and begin with the getting set up before we actually start changing, okay? Alright, so again, can never be too safe on hand hygiene. Okay, I'm going to go ahead, put on my gloves first and wipe down my table. Oh my goodness, maybe. Okay. So I'm also going to make sure this is above my waist. Okay. So also, can you tell me, are you in any pain today? No? Okay. Well, I'm going to go ahead and administer some medication because when I start to change your wound, you may experience some pain during that time. And one of our biggest priorities is to minimize your pain. Okay, so I'd let this sit for 2 minutes because that's what the manufacturer requires. And at this time, I'm going to go ahead and assess your wound. Okay, do some hand hygiene. And at this time, I would have also administered the medication. Made sure I waited 30 minutes so that it kicked in for them. Okay, and if I go too fast, just let me know and I will slow down even more. But I'm going to take my time taking this off so I don't hurt you any, okay? Actually, hold on 1 second. You know what? I forgot something very important. I need my bag just in case if you have any soiled like drainage and also like blood on your bandages. I'd have to throw that in my biohazard bag and take that to the biohazard room. So big step, almost forgot. Okay, put the pad down on the side. Okay. All right. Put your hand right there. Okay, I'm gonna go ahead and I'm checking. I don't see any blood or any drainage, but I'm gonna go ahead and throw this in my biohazard bag. And then I'm gonna go ahead and check each layer, and I don't see any blood or any drainage. Second layer, I don't see any blood or any drainage. And then the second one, I don't see any blood or drainage. Okay, so now I'm going to use my sterile tweezers to remove your strip, and I'm also going to measure it and make sure I get the same length when I go ahead and repack it. Okay, and if this hurts at any time, just let me know, okay? Alright, looking, and I don't see any drainage, and I don't see any blood, so that's good. And now, okay, I'm gonna go ahead and I put these in my sharps container. I'm gonna set them right here, pretending that's my sharps area. So I'm looking at your wound and I'm going to assess it for Rita. So I'm looking for redness and I don't see any redness. Edema, I don't see any edema. Ecchymosis, which is bruising, and I don't see any bruising at the site. You didn't have any drainage, and then also approximation, I didn't see any of that because it is a circular wound compared to such like a linear wound that could have little breakout areas. So I'm gonna go ahead and I'm gonna prep some more before we actually begin to touch the wound. Okay. So I'm going to grab my strips, and then I'm going to grab my solution. I'm checking for the date. Though it says it expired, we're going to use it for demonstration purposes. And then I'm also checking my strips, and they look good. Okay, I'm going to go ahead and also just prep them and get them ready. Also, I'd be checking, making sure there's nothing floating or anything abnormal about the solution. I'm going to go ahead and dump out a little bit. Okay. So now that is prepped. And now I can go ahead and get my kit. I have it ready. Okay. I can throw away this portion. And then I'm gonna go ahead and wash my hands one more time since I was near the trash can. Though I didn't touch it, I still just want to be careful. Infection prevention is yes. Okay, so I'm gonna go ahead and open it away. Okay. Keeping in mind of our 1-inch border, I can go ahead and take out my gloves, and then I'm going to gently go ahead and let out my contents. Okay. And now I'm going to go ahead and put my solution, each one. Okay. And now at this time, I'm going to go ahead and start with my gloves. I'm going to go and open them up real fast, making sure that cuff side is facing me. I'm going to move that just a little bit. Okay. And also, I'm going to recap that real fast. Just in case, don't want any spillage. Okay. Alright, starting with my non-dominant hand, I'm going to go ahead and pinch my glove and walk it back. Turn it sideways. And though I did not get my glove on properly with all the fingers in their holes, I can fix that after I get my other glove on. Okay, so now I could go ahead and let that go. All right, and now I'm gonna go ahead and I'm going to put 3 of my gauze pads in here because I'm going to use them to clean the wound. Okay. And now with the tweezers that I was given within my packet, I can go ahead and I can grab my strip. Okay. And I go ahead and I put that in the solution. All right, now I am done with these and I can put them in the sharps container. Okay, so now I can go ahead and I can grab my gauze and I can clean the wound site. Okay, making sure to fold up the sides. Okay. Are you having any pain? No? Okay. So 1, 2. Okay. Throw that in my bag. Grabbing the next one. Okay. And now 1, 2. And then our last one. Okay. Now 1, 2. Okay, so now at this point I can go ahead and proceed with grabbing one of my Q-tips and getting my strip. I'm going to go ahead and remove the excess solution. That way I do not get it all over my patient. And then I can turn it 1.5 times. Okay, making sure not to touch the wound. Now I go in the opposite direction. Okay, and now going in a zigzag pattern. Okay, and leaving the tail out. That way it is easy to access later on when I need to change her wound again. All right, so now I'm going to take 3 more gauze pads and I'm I'm going to place them over top of the wound. So I've got 2 there. And here's another one. Okay, so here's 1, 2, and now 3. Okay, and now I can go ahead and place this over top. Okay, and at this point, I can go ahead and I can remove my gloves. Oh, as soon as I take out my tape. Okay, all right, now I can remove my gloves. Okay. All right, and I can dispose of those. Now do some more hand hygiene real fast. Okay, and with my other scissors over here that are also sterile, I'm going to measure my tape, and then I'm going to tape my patient's wound. And right now I'm just making sure that I'm measuring each piece so that they're all equal. All right. And you're not sensitive to any, say, tape or adhesive material? No? Okay. Alright, and now I'm going to go ahead and I'm going to add one more piece of tape so that I can document. Alright, so it is 10-8-22. And the time is 13:25. All right, and then my initials. Okay, so now I'd go ahead and I'd get rid of the biohazard bag and the biohazard trash can over here. This is also my sharps container. Alright, so I'll go ahead, not to actually put in there, but just so you know. And now I'm gonna go ahead and I'm gonna wash my hands again since I just touched trash. I'd go ahead, I'd get rid of the liquid in here and the appropriate area I'm supposed to. Go ahead and I'd shut these. I'd go ahead and I document that the time and the date that I used them on both of these so that they can be used for later on. And then I'd also go ahead and dispose of this at this time. And then I'm gonna go ahead and ask my patient if he has any questions or if he needs anything at the time. Also, I'm gonna go ahead and cover him up. Do you wanna be left in this position? Yeah, okay. All right, well, I'll be back in to check on you. If you need anything between that time, just let me know. And this concludes my video.